It's a huge statistic. Nearly 1 in 4 American adults lives with chronic, debilitating joint pain, and yet a lot of people suffer for years without doing anything about it, getting a knee replacement or a joint replacement surgery. Concern over COVID-19 has also become a major factor in those delays. Dr. Mark Klassen and his patient Becky are joining us this morning with what we need to know and why it is so important not to put off getting surgery. Great to have both of you here today.
Well, thank you. Thank you for having us.
So a lot of people are putting this off over fears of COVID-19, not wanting to go into the hospital, which is understandable. What are you seeing right now? How big of a deal is this, and what would you tell people?
Well, it's certainly a big deal. People have been concerned about COVID. In this pandemic, we had 6.2 million cases canceled, and so we're taking precautions to make sure everybody's safe. We're testing people, we're quarantining them before their surgery, they're having their surgery. The ORs are being deep cleaned between cases. We're doing the follow-ups virtually with the family. We're doing everything possible to keep the family, the patient, and the surgical team as safe as possible. And I think you need not to be afraid with the pandemic going ahead with elective surgery.
What are some of the consequences if they do put off the surgery?
So it becomes a quality of life issue. It's being mobile. It's not being able to do the things you want to do. So we want to increase your mobility. We want to get you back on your feet. We want to get you back to walking, to biking, to visiting friends, family, and outdoors doing things. And I think if you're inside, you're not moving, you're hurting, it affects your heart, your lungs, it affects your whole health. So it's important to go ahead. We're here with Zimmer Biomet to raise awareness on a program called Don't Let Pain Gain on You. And there's a website that you can go to that's a resource, don'tletpaingain.com. That's a great website to go learn about this.
And I know, Becky, you suffered for a long time with joint pain. How did it disrupt your quality of life?
All right, by last fall, I was really having a lot of problems. I have arthritis and my knees were really hurting. I was in a lot of pain. The cortisone shots weren't working anymore. And so as Dr. Klassen always said, you'll know when it's right time for you. So wanting to be active and independent yet, in my 70s, in my later 70s, I went ahead and had the first surgery done right before the COVID, the last day. And then I had my physical therapy at home. I kept working on it. There wasn't anything else to do. Read books and do your therapy. And then I thought, well, why don't I go ahead with the second surgery? After all, I can't go traveling or anything. So 3 months later, I scheduled the second surgery, and that one was a partial, done in the surgical center. Felt totally safe. No qualms about it whatsoever. And for me, it was certainly the right decision to move forward and have my surgeries done. Talk to your doctor. Everything's in place for your safety.
What would you tell somebody out there right now who's living with this pain and who's hesitating about going in and having the surgery?
I would encourage them to go forward. Talk to their doctors. There's no reason not to go forward. We live in America. We have wonderful medical teams. They have everything in order, all the protocols. So go for it. It's worth it. You want quality of life, and you don't have it when you're in pain. It interferes with everything. Enjoy those grandkids. Get out there and do things with them. So I would say go on the website again, don'tletpaingain.com, and talk to your doctor. Go ahead with it.
Wake up happy and pain-free every day. Dr. and Becky, thank you so much for being with us this morning.
Hey, thank you for having us. It's been a pleasure.
You're watching The Morning Blend. We'll be right back.